Should you get your wisdom teeth removed? Is the wisdom tooth removal process painful? And how much does it cost to extract these teeth? I'm going to be answering the top 10 questions you might have before you get your wisdom teeth taken out. What exactly are wisdom teeth? Your wisdom teeth are the 4 permanent adult teeth located at the back corners of your mouth, and sometimes you can feel them if they're totally erupted, and sometimes you can't feel them if they're underneath the gum and the bone. These teeth typically appear at the age between 17 and 25, but some people never develop wisdom teeth, and we call that congenitally missing teeth. Number 2, do you need to get your wisdom teeth removed? So not everyone has to get their wisdom teeth removed. In fact, if they erupt normally and they don't cause you any pain or discomfort and you can keep them clean, then hopefully you'll have the wisdom teeth for the rest of your life. But if your jaw doesn't have enough room for the wisdom teeth, sometimes they can get impacted, which means that they're stuck under the bone or the gums of your mouth. For these impacted cases, they can be angled in any direction. They can be angled towards another tooth, they can be angled away from the tooth, they can be under the bone entirely, and things like that. Number 3, if you're not having any pain and the teeth are totally erupted, why would your dentist recommend getting that wisdom tooth extracted? Number 1 is if you're undergoing orthodontic treatment or braces, sometimes the wisdom teeth need to be removed in order to have enough space in the mouth to move your teeth the way we want to move them. Number 2 is going to be that if your wisdom tooth develops a cavity, a big cavity, typically it's going to be more efficient, cost effective, and it makes more sense to take the wisdom tooth out versus preparing it for a crown. Now, this isn't for all cases, and typically we want to keep as many teeth as possible in our mouth that are functional, that help us chew. But in a lot of cases, if it's all the way back there and you have all of your other remaining teeth, then typically wisdom tooth extraction is not a bad option. And number 3 is that if you have gum disease, periodontal disease, where you have a lot of bone loss near the wisdom teeth, it's not a bad idea to get that tooth extracted so that you can take care of the molars and make sure that those are clean and you don't lose any other teeth in the mouth. Number 4, at what age should the wisdom teeth surgery be performed? Typically, we're going to recommend that the wisdom teeth get taken out at an earlier age, sometime between 15 and 25. And that's because of a variety of reasons. Number 1 is that when the roots aren't entirely formed, the wisdom teeth become easier to extract, and it makes the surgery less complicated, more predictable, and an easier healing process for you. Number 2 is that as we grow older, we can develop some other comorbidities, which can be a contraindication for extraction. And number 3 is that if you have wisdom teeth that are impacting the other teeth in a negative way, getting it taken out early can help save the other teeth in your mouth. Number 5, what is the risk of wisdom tooth extraction? Any surgery that we perform has risks that you need to consider. So for lower wisdom teeth, typically we want to make sure that the roots are not in close proximity to a nerve, what we call the inferior alveolar nerve. If the roots are embedded or in close proximity to the nerve or wrapping around that nerve, then wisdom tooth extraction can potentially lead to nerve damage. But this is why we take a variety of imaging in order to ensure that the roots are away from the nerve. And even if they are in close proximity to the nerve, a lot of oral surgeons have a variety of different techniques where they can remove part of the wisdom tooth safely and maybe leave the part close to the nerve, or they will section it into different pieces in order to ensure a safe delivery of the extraction. On the top teeth, we need to make sure that the roots are not in close proximity to the sinus. Typically, that's not a problem, but if the roots of the teeth are embedded within the sinus, we want to make sure that we don't perforate the sinus or create an oroantral communication, basically an opening between your sinus and your mouth when we do the extraction. But like I said before, with proper imaging, with proper techniques, this will be a safe procedure. And I'm going to leave a link down below that goes over any other risk that you might have to consider before getting your wisdom teeth removed. Number 6, are wisdom teeth extractions painful? And that depends on whether you're getting sedated or not. There are a variety of different sedation options out there. There's general anesthesia, IV sedation, oral conscious sedation, nitrous oxide, and just local anesthesia, basically no major sedation. And I've talked about all of these options before in another video, so I'll definitely link that below. But what you should know is that higher levels of sedation are going to make it so that when you're getting the surgery done, you don't feel anything, and later on, sometimes you don't even remember that much about the surgery process. But if you decide to go without any sedation, typically this is what you're going to experience. You're definitely going to experience a little pinch when they give you the numbing medication. That numbing medication can be painful for some people. Of course, we do a variety of techniques like applying topical anesthesia before giving the injection and things like that, but there is going to be some level or some degree of pain associated with that. After the anesthesia is delivered and the tooth is properly numbed up, then you shouldn't feel any sharp shooting pain when we're working on the tooth, but you will feel a lot of pressure. Remember that in order to get the wisdom tooth taken out, we're going to have to leverage between the bone surrounding the wisdom tooth and the tooth itself. That can cause a lot of pressure, and that pressure can be perceived as pain. Number 7, what are the steps of the surgery? Okay, so once you're entirely numbed up, the dentist is basically going to use leverage from their instruments, we call these instruments elevators, to basically create some mobility between the tooth and the bone. And in easy cases, if the tooth is conical in shape or bulbous in shape, the roots of the tooth, then we can use that leverage to take the tooth out and it comes out really quickly. The hard cases are when the roots are spread out or divergent, or if the tooth is entirely embedded within bone. In those cases, we have to use a dental drill to remove the bone away from the tooth or remove the bone to expose the tooth, and then we have to try to take the tooth out. And when we're taking the tooth out, we might have to make it smaller by sectioning it into little pieces. I know this sounds scary, and the reality is there's a lot of noise that can be uncomfortable, a lot of pressure that can be uncomfortable, and once again, in those harder cases, I would definitely recommend doing some type of sedation to make the procedure a little bit more comfortable for you. Number 8, what is the healing process like? Healing really depends on the difficulty of the extraction. If we have to remove a lot of bone around the tooth, then that healing time might be longer than for someone that you don't have to remove any bone with conical roots, where the extraction is really easy to deliver. So just know that healing times are going to differ for each patient, and they're going to differ for each different type of tooth. Typically, we're going to give some type of pain medication. We might deliver some antibiotics because remember that it's an open wound and we don't want there to be an infection or inflammation. The next couple days after the surgery, there will be some tenderness. You might have some inflammation on the site. It may be a little bit sore, and especially if there was a lot of bone removal and the teeth were under the bone, you might need a couple weeks to fully recover and feel back to normal. So typically what I recommend is to get the extractions done on a Thursday or Friday so that you can heal over the weekend and it doesn't interfere with your work schedule, because I know all of us are working and we don't want to be having dental pain when we're working. The dentist is going to give you post-operative instructions, which goes over the diet you should be having. It goes over how to take care of the site. And I definitely encourage you guys to read that very carefully and follow the instructions diligently, because if you don't, it can lead to longer healing times. It can lead to a lot of pain. So I definitely encourage you to read the post-operative instructions. Number 9, what are some of the top post-operative instructions for healing? Number 1 is no smoking. This does sound obvious, but you definitely don't want to smoke. You also don't want to use a straw or any negative suction like spitting out or rinsing vigorously in your mouth, because we want to maintain the blood clot that's in the open wound. Basically where the tooth was removed, there's a site, an open wound, and we want to maintain that blood clot. If that blood clot gets dislodged, it can lead to a post-operative complication that we call dry socket. Dry socket is basically exposed bone, and it can be really painful, really uncomfortable, and it's definitely something that you don't want to go through. Definitely take it easy with the workouts or running or jogging or any strenuous activity, because when you're doing these activities, it can increase your blood pressure and it can increase bleeding at the site of the extraction. So we definitely want you to be careful for that. We also don't want any spicy food or crunchy food or things that can create little particles that get embedded within the extraction socket, because that's going to delay the healing process as well. Typically, I recommend a soft food diet, and just try to understand that we don't want anything to go in that socket. And finally, warm saltwater rinses definitely help with the inflammation around the extraction site. And of course, we still want you to maintain proper oral hygiene for all the other teeth, flossing, brushing, and just be careful not to irritate the extraction site when you're doing that. Number 10, what is the wisdom tooth extraction cost? I always get this question and it's difficult to answer, but I'm going to try my best. The first thing that you should know is that easy extractions, ones that can be delivered by just using leverage and force, that's going to cost less than an extraction where the tooth is entirely under the bone and it requires more care, more experience, more expertise to remove the bone and deliver the extraction. So there are different types of extractions out there. There are simple extractions, there's soft tissue impacted extractions, there's fully bony impacted extractions, and a variety of other extractions, you should also know that going to a more experienced person like an oral surgeon might have a higher cost than going to a general dentist. Insurance definitely plays a part, so if you have good insurance that covers wisdom tooth extractions, you're going to incur a lower cost or copay versus not having any insurance at all, so that's something to consider as well. Well, I hope I answered your questions about wisdom tooth extractions. I tried to be comprehensive. If you guys have any questions or comments, or you want more clarification on some of the topics I was talking about today, feel free to leave it down in the comment section below. Thank you so much for watching, and I'll see you for the next one. Thanks.